close to 500,000 Kenyans already having been vaccinated with the AstraZeneca vaccine, the Ministry of Health maintains that the benefits of the vaccine will outweigh the risks and that the vaccinations will continue as planned. And even though other countries that had already administered the AstraZeneca vaccine are considering a different vaccine from the first for the second dose, this is not yet a priority for Kenya. This even as 1,091 more people tested positive for COVID-19 and 17 deaths were reported, all which occurred in the past 1 month. Dr. Swangira reports.
Kenya has already administered more than 400,000 doses of the AstraZeneca vaccine, with those already having had the jab expecting their second dose in May. Yet against this backdrop, safety and availability concerns of the AstraZeneca vaccine remain a global conversation and the one that keeps necessitating a change in strategy and rollout. For instance, the French National Authority for Health, Autorité de Santé, in March said the AstraZeneca vaccine should only be given to those aged 55 and over because of reports of potentially deadly blood clots in a very small number of those younger people who have been vaccinated. The Philippines suspended the use of AstraZeneca shots for people under the age of 60, while Australia recommended people under 50 should get Pfizer's COVID-19 vaccine in preference to AstraZeneca's, a policy shift it warned would hold up its inoculation campaign. Speaking to Citizen TV, the Ministry of Health's Acting Director General Dr. Patrick Amoth said, and I quote, "On the balance of probability, it is safer to take the AstraZeneca vaccine rather than not taking it. The blood clot effect is extremely rare in the United Kingdom. It has been registered in 1 person out of every 600,000 vaccinations. The chances of getting it and dying from it is 0.000095%, and there is still no direct linkage established between the vaccine and the clotting," end of quote. Further adding that Kenya has not yet recorded a single event of life-threatening blood clots. Kenya is following the WHO advisory that says the benefits still outweigh the risks and will continue with the vaccinations as planned. However, those with a history of blood clotting should not take the vaccine until there is more evidence. AstraZeneca's shot is cheaper compared to other vaccines. It is by far the cheapest and most high-volume launch so far and has none of the extreme refrigeration requirements of some other COVID-19 vaccines, making it likely to be the mainstay of many inoculation programs in the developing world. With the global supply of the AstraZeneca vaccine being limited owing to India temporarily halting exports, Kenya, just like the rest of the world, is also weighing other options. Dr. Amoth on the issue of supply further adds, and I quote, "It is only natural that India would prioritize their own people following a spike there. But we have been assured that we will get our next batch in time, that is, at the end of this month. The problem is not unique to Kenya. The Serum Institute of India produces vaccines for many countries around the world. There are ongoing discussions at the African Union about the possibility of getting Johnson & Johnson doses, but owing to the high demand, even if we ordered today, the earliest we can get them is June," end of quote. Is the mixing and matching of vaccines recommended? The World Health Organization currently recommends the same product be used for both doses, but has further said that research should be carried out on the interchangeability of the vaccines in the so-called mix and match strategies. In the last 24 hours, 1,091 more people have tested positive for COVID-19 out of 7,300 samples, with a test positivity rate of 14.9%. 17 deaths have been recorded, all having occurred in the past 1 month. 1,605 patients are admitted in various health facilities. Dorcas Swangira, Citizen TV, Nairobi.